During the Public Service Recognition Week 2022, we're celebrating 5 of our executive program alumni and wish to gain their insights about leadership. Today, we're happy to feature David Cardenas as the Deputy Director of the Operations Support Bureau for the LA County Department of Public Health. David, thanks for joining us.
Thank you for letting me talk to you today, Paul.
David, when you think about where you are right now, when people ask you what you do, what do you say?
I say that I am now, and this is actually a very recent appointment, but recently appointed to serve as the Director of Operations, which includes all of the back office functions, essentially for the Department of Public Health, which includes contracting, finance, human resources, information technology, kind of facilities management, procurement, our supply chain. So essentially everything that runs the gamut of providing support to our frontline teams within the department. I basically have under my authority and control now.
Cool. I'm going to have lots of good questions for you about that, given the pandemic that's happening and you being in public health. Right. But before hitting you with a bunch of those questions, when you think about your career trajectory, how'd you get to where you are?
It's actually interesting because I kind of fell into each of the roles that I went to. I always had coming out of I went to get a master's in public health, so that's always been my leaning has always been healthcare, specifically in terms of orientation towards public sector and public service. So certainly I opened my doors into the department as an epidemiologist. I kind of came in working in kind of a technical specialty within public health that was focusing on disease control and investigations. And right as I jumped into the department, this was about 20 years ago, 9/11 happened. And I got swept into the bioterrorism space and became part of the Homeland Security apparatus, essentially, and the response teams for the county. And that opened me up into roles in kind of advanced communications, kind of the higher technology, more advanced technology aspects of the work that we do in public health, and try to, remake our infrastructure to be able to handle what the new threats that were, coming forward at the time after 9/11 were presenting to us. And that kind of swept me into this world of technology management and oversight. And then that also then led into, me eventually, taking that path within public health to pursue an information technology leaning over the last, I would say, 15 years. And it gave me a chance to sample pretty much all the swath of public health, because in that role, I was cross-cutting and serving all areas of the department. So I got to see, kind of the full breadth of the work that we do and providing ways to provide more efficiencies and support for that. And then through that, you invariably understand more of the nuances of administration and how the department works. And then I was considered for the role that I'm in now. And so, I'm, again, just newly appointed to this role in the last 4 or 5 months. But I think it was that grounding and that exposure to all aspects of our department and our operations that allowed me to kind of fit in and feel comfortable in the role that I'm in right now.
Man, you really have been part of public service during some really huge milestones within our society, and not placing a judgment statement on it, but huge events from 9/11 to the pandemic now. How have you seen the role of public service leadership within those spaces, and how would you define public service leadership?
I think what's been so interesting over the course of my career is to see, especially now, I've almost been bookended by 2 major crises that the country was going through. And what you see is I've seen the public health under very strict lens and scrutiny, and public health in the background, where in most times people don't realize that we're operating and doing the kind of work that we're doing. And it causes a lot of interesting issues with regard to how do you fund operations, how do you support critical programs that are focused on trying to improve the healthcare of our residents, or maintain the health and protect the health and safety of our residents, when you're not getting attention, when you're essentially kind of seen as a supporting role to the hospital systems and the healthcare systems that people traditionally associate with the things that help to monitor their health and improve their health are really about the health system that you engage with on a daily basis, not those of us who are sitting here on the back end trying to provide prevention strategies to kind of keep you well and keep you from having to engage with that health system in that way. So it's been very interesting to see those high points where we've gotten a huge amount of attention, not because we want to be in that situation, but because we've been forced to kind of have to look at these very critical crises, and where we have a lot of attention placed on us versus these dips where we found that we don't get a lot of the attention that's needed, and we're still trying to do a lot of the same work, trying to put new initiatives out there to kind of help support improve the health outcomes for our residents. And it's a challenge, right? Because you're seeing that ebb and flow and having to adjust, your expectations about what you can do, given shortfalls in funding and budgets and other things that you run into.
When you're thinking about the cycles, I mean, that's an important realization, right? To be able to see, where those ebbs and flows coming in just in the line of business. Are you feeling it right now in a different way than you're anticipating to feel? I'm assuming you're getting a lot of attention still, but that might not be true.
Yeah, I mean, again, I think this is kind of a hard place to be, right? Because I think we're still seeing ourselves in the same role of having to provide, protection and guidance for the populace, and you have people who are just exhausted by the last 2.5 years of going through all this, and so your ability to message, your ability to connect with folks, your ability to try to communicate that you are still trying to act in their best interest. Some of those messages are very hard to deliver during that time. So your messaging, your leadership style, the way you approach and engage has to evolve too, and be more sensitive to the fact that people kind of just are now over it. And now what do you do? Because you're still having to do the same work. This isn't over. And as much as we believe that it is, it's kind of caused us to have to adjust. And it's a very difficult place to be, because the demands are still there. But now we're slowly receding into the background, and people are actively trying to push us into the background because they don't want to deal with this stuff anymore. And so it's hard messaging when that happens, when those situations occur.
Can you talk a little bit more about working within that type of environment where the type of pressure keeps on shifting? So what I'm not picking up from you in our conversation is that the pressure has stopped. It's just coming from a different angle right now, influencing the work that you're doing. Can you talk about what it's like working within an organization that is facing high pressure on a regular basis?
Yeah, I think what I've been found so astounding and actually surprising and in a good way, I think, has been that when you're under such scrutiny, it brings out the best, and you'd think that it would bring out the worst in people, right? Because the stress doesn't usually lead to people performing well. But when you're in this environment and you're around the people that I'm with every single day who are very committed to the work that we do, you see people stand up to the challenge, and they step up in amazing ways. And I think what we found during this time was people were supporting each other very significantly. Like, everyone stood up for one another and was able to kind of take those challenges and were taking their part in terms of and really living into their role as whatever response element they were in charge of for moving these things forward. And I think so. You think that these crises the stress kind of pulls people apart, but it actually does the opposite. And I had the same experience after 9/11 when we were dealing with the threats of the anthrax attacks that were going across the country, dealing at the time. It's kind of a bonding experience almost, and so you're allowed. You give yourself an ability to kind of help respond. So when you're going through, it's reactive, right? So you're just kind of working through that in real time. So you're not really thinking about all the stress. You're tired, you're exhausted, you feel all that, but you're still moving. It's after it kind of wanes and you start to see, wow, look what we just went through. Then you start to kind of figure out it's a little bit harder, I think, to engage at that point with kind of a lot of the negative issues that come along with that stress and that level and working under that kind of pressure. But when you're going through it, you're just doing it. You just know you have to get through it. You have to be committed to the work because we're in charge of saving lives. It's part of the work that we do. And you just, you don't spend too much time. You don't have a lot of time to dwell on, how to get through it. You just start doing it, really.
Can you talk more about those bookends of what you're describing, right? Because that support mechanism just doesn't happen automatically, right? It's the culture that's created among your team to allow that to take place. And then on the other side of it, almost that pressure release in some ways, but the stressor still being there. Can you talk about what it's like being in those team environments and the role of leadership as it shapes the teams and shapes the team culture?
Yeah, I think in the end, there's something about having worked in this department for as long as I have that I've seen. It almost has a very familial type of atmosphere most of the time. Everyone really knows each other very well. We're large enough that we have a lot of capability and wherewithal, but we're small enough that people do know each other by name. And so when you're engaging with your colleagues, it's a very collegial type of setting. So that helps, I think, in those kind of response times that you are feeling like you're supporting a very close person in your life, right? It's not someone who's at a distance that you don't know. So I think that that certainly came out during during these response periods. I saw that in 2000 and 2001, 2001 and 2002, when we were kind of responding to those attacks. And then the same things that's happened during COVID is that you've had that feeling of, the team kind of really comes together. I think when it's the time of release, there's other pressures. There's just different kinds of pressure, right? That work of having to deliver and having to be accountable to the public for the services that we deliver. There's a heightened sense of that always been in this department, always been in public health. There's always been this belief of our mission really drives, and there's so much passion among the folks that we do that you don't pull your foot off the gas. It's always kind of on at all times. It just feels different. I think that what difference, Paul, is that there's the gravity of it, right? I think when you're in those moments, like you really feel your role, you really feel your responsibility and your accountability. When you're not in that pressure and release, it doesn't feel as stark. It doesn't feel as grave in those situations, and you still feel like you can still do the work and how important the work is, but it doesn't have that magnitude isn't there. And so I think you're able to kind of operate differently. But I think that's probably the main difference that I notice is that we're always coming together. It's just the way that the nature of the work that we do together in our department. But it's during those moments when you really see people really own and understand how important and significant the work that we're doing is, and how people really apply themselves during those moments.
Yeah, man. When I think about public health, you recognize how broad it is as a field. And I want to ask a question about how you do the work that you do, right? So you gave the examples of 9/11 and thinking about anthrax and what happens if we have this biochemical coming into our communities and how do we respond to it, and then to today where you're looking at COVID and what are those COVID measures that we should be undertaking. When you're talking about anthrax and you're talking about COVID, they're two very different types of health concerns. And I would suspect that in 2019, you're talking about something totally different that wasn't in either one of those spaces. When you're working with such a broad mission to advance public health within a specific geographic region, how does that shape how you interact as an organization?
So I think the main difference that happens during response periods and emergencies is that we borrow from well-heeled public safety principles in terms of how you manage during emergencies, which requires you essentially to kind of flatten the organizational hierarchies and establish kind of virtual teams in terms of the response, and that's under an incident command structure. So we operate very different during response periods than we do during the day-to-day. The day-to-day operations is full of a series of organizational units that are all manned or supported by or have leads essentially that are subject matter experts in those spaces. And we have dozens and dozens of programs within public health that are each kind of focused in these different areas. During the emergency periods, all that kind of goes away. All that existing organizational structure doesn't really have as much resonance, and there's basically these isolated teams that are brought together to command various aspects of the response. And it does become a very command-oriented structure. That way you can streamline decision-making and work more quickly during those periods. And so there's definitely a very unique difference about how we manage during those events as opposed to during the normal periods.
I mean, that's a huge difference. And I wasn't even thinking in that space that you would go into an incident command type of scenario with COVID. When when you went into those, at least the early responses to it, did it go through the Office of Emergency Services?
So we work in close collaboration. We were serving as the lead agency, but the Office of Emergency Services essentially has a responsibility for coordinating all things that go beyond the wherewithal of our department, right? Because we're 5,000 plus strong. We added almost like 2,000 people to our roles over the last 2 years to kind of help with our expanded response. But there's obviously more than just the work that we were doing. There's a whole series of departments that were involved in doing various aspects. Our partner health agency and health services had a major role. We had support from the fire department. We had support from other parts of the county, and OEM essentially serves as kind of the hub for the coordination of those other elements. And so we would make requests to them, and then they would help to support those requests, but all in service of us in that kind of that lead role. So, and depending on the emergency, sometimes we're the lead, and it's actually seldom we're the lead, because most of the time we don't really have these, large pandemics or biological type of issues come up very often. That doesn't really happen. It's really more of, traditional emergencies, fires, earthquakes, those are the kind of things that you think about where their lights and sirens are the leads. Sheriff's department, fire department, they're usually the leads, and we're supporting them in that role. So it's kind of a very different aspect, but OEM is kind of still that coordinating function for the entire county.
When you think about relationships, they look different depending on what's happening, right, in the space. When a multi-jurisdictional incident happens, I recognize how important the relationships are to be pre-established prior to the incident happening. How do you think about relationships with, I'll frame them as external stakeholders. You reframe it in a way that makes sense from your description of it, but outside of the Department of Public Health, how do you think about those types of relationships, and how do you go about building them?
So obviously there's probably no greater importance that we have in terms of the work that we do than relying on our medical community partners, whether they be physicians that work in private offices, as well to hospitals, clinics, pharmacies, a whole network of community-based organizations. That was highlighted, definitely especially during COVID, that we relied on that same network of folks that we rely on a day-to-day basis to provide us with information. They're the sentinels. They're the people that are looking out in the community for things that are going on, and those are reported to us. And then we put all that information together to begin our acting and putting our response operations together. And so our network, the work that we do, heavily relies on that network of partners that we had already established, and we built even more during the response. But certainly, everything in public health is about community-based type of engagement. So, we focus a lot on developing those partnerships, developing community partner engagements efforts that are very expanded, because we know that that's the core of the community-based approaches that we have to implement. So that's the core of public health, is based on those things. And then beyond that, we have our public health system partners, right? We have the state that we interact with very significantly, and our fellow county partners. LA is huge, but obviously our borders, kind of bleed into San Bernardino, Riverside, Orange County, Ventura County, and so we have to kind of respond as a regional response way as well. And so I think that also kind of puts an interesting lens on the work that we do, because we're not insulated. We have partners that people move across the boundaries of our counties quite liberally, and so that means we have to have active communication with folks within the region, have to talk with the state, because they're a controlling element in terms of leading the response for California. And then the CDC, from a nationwide standpoint, wants to know what's going on in California. They want to know what's going on in LA County, because that's helping them to determine how they map the response out for the rest of the nation. So there's very critical partners that we work with across the way to make us successful in doing the work that we do. Without any of that infrastructure around us that helps support that, it'd be a much more difficult task to do the work that we do.
When you're looking at the leadership involved to make all that happen, I'm curious about what might be shifting based on the last couple of years. So in other words, I've been thinking about the leadership approach that happened within you or within your organization, maybe prior to COVID. What changed in COVID that's going to carry forward, that's shaping the way you're thinking about some of these leadership principles?
It's interesting that I think the things that felt like barriers and traditionally, right? In terms of, the state always had a certain role that they played in terms of the work that we do. They had certain responsibilities. We have certain responsibilities. And we would debate a lot about, drawing those boundaries, making sure that we were interacting in ways that were respectful of the ways of the responsibilities that we each had. Same thing for kind of internally. We have those situations, right? But when you get that external pressure that's so great and of such a magnitude, I think we learned to kind of communicate differently. I think we certainly saw how we could lean on each other and how the partnerships were probably stronger than we probably even realized. And in the end, the things that were important to talk about during the normal periods just didn't seem as significant a barrier that we shouldn't be able to do something during emergencies. So I think the posture, I think, just feels different, right? And that you create those relationships. Again, in the end, Paul, all this stuff is about personal connection, right? And it's these crises that really bring people together in very interesting ways. I have people now at the state level that I consider friends as a result of the last 2 years that I barely knew before the event, and it's because we went kind of through the fire together, and we learned how we were going to negotiate through some of these tough things that we were dealing with, and those relationships then help build momentum for something else now going forward, right? Because now new doors have opened because you have those personal relationships, and people understand how you lead and how you address the things that you're trying to address and what your motivations are. Sometimes it gets clouded during those non-crisis periods. And so I think we really are trying to leverage and say, we did something good during these last 2 years with a lot of good stuff together. And how can we build on that to take that same energy and apply it to some of these other nagging things that we've been struggling with for 5, 10, 15 years, and that it's put a really good lens in terms of the relationships that we have with people. I really have enjoyed that part of it, of being able to build those connections and see, the potential for where those new connections can take us.
And I really just want to have a 2-hour conversation with you, and need to be mindful of your time. Certainly those barriers come into play, and when you think about the relationships, those are all really important things. Want to know about advice that you have for us in public service when you're thinking about this larger idea around leadership. What advice do you have for us? So
I've been very fortunate, I think, over the course of my career to have connected so deeply to the mission of the work that I do, that it makes coming to the office and doing the work that I do enjoyable, despite all the things that you could think about would be not so enjoyable about working in a county this large with this much infrastructure that you have to kind of maneuver to be able to get certain things done. So I certainly feel that, right, that this idea of there's so much that you can do in the public service arena that is beneficial to so many. But find the thing that really makes you connect to something deeply, and you'll see your performance is just different when you're more invested, obviously, in it. And the other thing I think that I would also say is, especially having managed teams for so long now and in the public sector, the stereotypes that are out there about public service are very interesting, right? And they're usually politically motivated. Somebody's trying to communicate a message about what we do in government, and they're doing that for whatever reason. But when you really look behind the curtain about how the things that we do, especially like if you come and look at the people that I interact with on a daily basis within my own department, I think you'd be really impressed with the fact that that it's not what people frame it as, right? It's about doing a lot with very little. It's about people who are extremely competent, extremely capable, and so impressive to be working around very bright, articulate people that just want the challenge, want to meet the challenge with them. And so to be able to partner with folks and to collaborate folks in that space and have that opportunity to lead alongside them is really inspiring. So I think that if people are considering a career in public service, to not be compelled by the stereotypes or what you hear, the experience inside is very, very different. And you start to see there's a lot of challenges. There's certainly a lot of things that people talk about, the ability to move things forward. You always feel like you're pushing on the ocean when it comes to government service, but it's because the magnitude of the work is so big. right? We're trying to support and help 10 million people in the operational area of LA County, and it's growing, and the challenges are constantly changing, and so that requires a lot of thought and careful investment and time, and so sometimes things don't go as quickly as you'd like them to, but there's usually a lot of reasons why that happens, right? And you're having to deal with a lot of different stakeholders in doing that, but that's part of the reward, right? I think there's fun and challenge and all that, and I've always kind of seen it as kind of an intellectual challenge to kind of engage on a lot of these different things, and so that's what I've enjoyed. So I think if there's two messages, it would be that. All that I think I want people to kind of think about when they're considering public service.
Man, David, I love it. Thanks for all that you do to advance excellence in public service as you model, inspire, and lead the way. Thanks, David. Enjoyed our conversation today.
Great. Thank you, Paul. Appreciate the time.